Cholesterol is a fatty substance present in many of the body's hormones that is necessary in the development of the brain and spine. But when does cholesterol become detrimental to our well-being? Parkview cardiologist Dr. Roy Robertson explains the difference between good and bad cholesterol.
The softer the cholesterol particle, the better it is relative to having a harder one. So when we break out the cholesterol levels, we have triglycerides, which are like big marshmallows. And those are from simple carbohydrate metabolism typically. So those come from things like refined white sugar. That kind of fat is less harmful to the body than the bad cholesterol, or the LDL. LDL looks more like a BB. And those little BBs, they tend to go where injuries are in the blood vessels and stick there and then cause plaque buildup, etc.
Identifying the form of cholesterol is important, but it is also crucial to keep factors like family history and overall health in mind when measuring cholesterol.
We measure everything in context, and that will dictate what your cholesterol level should be. So if you have zero risk factors and your bad cholesterol level is 125, for example, your LDL is 125, that may be perfectly fine. If you've had a heart attack and you're leaving the hospital and your LDL is 125, we really want to get that number down to 70 or less. So we really concentrate on the coinciding factors that would dictate what your cholesterol level should be.
When it comes to altering your diet, be mindful of fatty content in the food being consumed.
So when we consume saturated fats, for example, the things that we find in meats and baked goods, that kind of thing, what happens is the body then metabolizes that through the liver. Then there's production and release of cholesterol in the system, and actually we can measure cholesterol by just getting a blood test and identify how much cholesterol you have in your circulating blood and how much good cholesterol you have, how much bad cholesterol you have, and then how much of the triglycerides we have.
While a diet consisting of less sodium and saturated fat is essential to lowering high cholesterol, exercise is also necessary to realize change.
We need the exercise to generate metabolism of the muscles so that they help to metabolize these cholesterol products in a favorable manner. So in isolation, diet will do some, but it really won't do what we need it to do.
And before you panic about your numbers, remember that healthy cholesterol is measured by the ratio of good and bad cholesterol in our bodies.
We can differentiate the good and the bad and then help individuals identify what you need to do with your diet and what we need to do with other therapies, be it medication, over-the-counter, or medications prescribed to help influence your cholesterol level.
This has been Making the Rounds, brought to you by Parkview Health.